This is the SSAT Resident Corner, and today we are going to make a wonderful interview for the Mentor of the Month. And I have the privilege to interview one of our mentors here at Case Western Reserve University, our Department of Surgery at MetroHealth System, with Dr. Paul Priebe, that he recently retired, but is still having a very fruitful activity with our department, and we are very proud of it. So,
thank
welcome.
you, Sergio. Thank you.
It's a privilege to interview you formally. We had plenty of informal conversation, but today we are going to pretend that we make it a little bit formal.
Yes.
So, Dr. Priebe was actually graduated in 1978 from our residency here at Case Western Reserve University, and since then he had at the beginning some period as a private surgeon with a very important private group close to Cleveland. But very soon he returned to our system, and he became an academic surgeon until very recently, again, that he decided to retire. So I will start. This conversation is going to be oriented how we teach residents, how is the new paradigm of surgical training, and I would like to know your opinion to talk about this with our residents. So tell me, what do you think it changed about residency training since you graduated?
Yeah, that's a good question, and it has changed very significantly. Back in 1978, there was no minimally invasive surgery, and everything was done open. And I think obviously the big change is now most surgery is being done in a minimally invasive way, and the open surgery has been more of a rare phenomenon. Unfortunately, the residents are expected to learn how to do both in the same period of time, and I think this is a really remarkable challenge for them. I think they realize the challenge, and I think this is why so many of them are doing fellowships in addition to their surgery residency, because of the volume of information they are expected to assimilate.
And what do you think? There are plenty of different models of teaching, like we know, but there is one particular that I'm a little bit interested more, and it's regarding the mentorship apprenticeship model, where you have a resident with you for a longer period of time. What do you think about that?
I think there's a lot of advantages to that, as long as the residents get exposed to a number of different attendings doing that. I think one of the complaints I had in our program was that the chief residents were only staying with us for maybe 2 months, and I really didn't think was enough time for me to get to know them. A relationship between a resident and attending is an ongoing phenomenon, and the more comfortable the two of them get with one another, then the more responsibility and independence the resident is going to get. And I think this is especially important in the operating room. Unfortunately, it's a truism in surgery that the most talented residents tend to get the most training and the most independence, when actually the reverse would probably be more effective.
Absolutely. Well, you know why he's a great teacher. And what do you think about the new resources that in 1978 was certainly not there, sorry, but about, for example, YouTube seeing an operation before going to the operating room, or even simulation? What do you think about that?
Yeah, that's a dramatic difference. For me as a resident, I would have to go to a textbook of abdominal operations and look at several different descriptions of the operation. Now, of course, they have simulation, and they have media resources where they can actually watch the operations. And I think this is a good place to start. I think it gives the residents a platform from which to observe the operation that they're going to see, which inevitably, one thing that hasn't changed, inevitably the operation that they will see will bear no resemblance to the one they saw in the medium coverage, because just in the nature of surgeons doing things in different ways, which is a very good thing. But it does give them a base from which to start so they can at least ask intelligent questions about what they're watching.
So if you want to say in general, having said that about simulation and looking videos before surgery, what do you think is the best way for residents to prepare for an operation?
Yes. Well, I think familiarity with the operation is important, and familiarity with the disease that is the diagnosis, because that often depends on how the operation is going to be done. And so that they can prepare themselves for what they're going to see. And once again, it's all a matter of being prepared so that you can ask questions, because you are going to see things that don't jive with either what you've seen before or what you saw in the media coverage. And after all, this is the important part of surgical education, is that diversity and assimilating all of that information.
So it's also, I think it's important too for them, like you said at the very last, is that they learn different way of doing things. And what they read on the book may be so different from what they see in the operating room in some ways, but probably it's not that different. They will learn that it's not that different when they have a better understanding of the operation, you know. And
but this is where they can ask questions of the attendings so the attending can explain to them why their approach may be different than what they had seen or read about.
Exactly. So coming out a little bit from the place that we love, that is the operating room, and bringing you out the operating room, how do you think they should obtain the most from a surgical conference? Either a departmental conference or an M&M conference or even a scientific conference, because they will be listening to different people, they will be a different level of training. So how do you filter all that information to come out from that conference with something, with some substance to bring home?
Well, I think the conferences should all be interactive. And they should involve case presentations, but I do think it's important for the residents and the students ahead of time to have some familiarity with the topic that is going to be presented, so that they have had the time, and these days it's so much easier to get on the computer and resource information so that they can learn a great deal about the topic that's going to be presented, so that they can understand the inevitable discussions and disagreements between the various attendings who are present, who may actually help them to sort out some of the question marks that they may have from their reading. Reading sometimes leaves questions that are not answered by the article, but this is where a teaching conference becomes very important. Similarly, going to scientific meetings, I always found poster sessions to be great, where I could actually talk to the researchers that were doing it, and sometimes you get a little different perspective of what the research actually means by talking to them.
Yeah, and also accommodating those things that you learn in a scientific conference to the resources you have in your own institution. Things may be wonderful for one particular highly specialized center, but may not be feasible or as great as it may look for a particular center, even if an academic center, but they didn't develop that specific area
Absolutely.
of expertise.
That's correct.
So, and you know that I am, with this accent, I'm not from here. And as a European descent and coming from a South American country like Argentina, we have a more encyclopedic type of learning there. And also we always give a lot of reference to the professor. So we had, as residents, when I did my first residency in surgery there, the chairmans or the attending rounds. So we had the opportunity to see live interaction of the surgeon with the patients, and also we have the opportunity to see how the surgeon will treat in normal situation their patients. So do you think it still is important? And if it's important, why you think is the reason we don't do it as frequently as we should?
Right. Well, I think it's can be very effective. For someone like me who loves to use the Hippocratic method of teaching, it's a great time for residents and students to ask questions, and which opens them up to questioning them about their question. But I think it's important for the residents and the students to see an experienced surgeon interact with the patient, examine the patient, and then come out of the room and discuss the various options that are available. And it doesn't have to be their patient. Discuss the way the patient is being managed by some other surgeon and other possibilities of approach. Because diversity of thought is really critical in surgery. This is a process that will be continuing through the remainder of their career, which only starts during their residency.
So, having said that, being so important, or another opportunity for learning, so do you think it's time constraint?
That's the problem. The problem is everybody is pulled in so many different directions now. It's hard to get everybody together to do this kind of thing, which is consuming. You may take at least an hour or an hour and a half to make rounds on a surgical service, but you could always put a time limit on it, or the chief resident could pick the various patients that they want to go over with the attending. It doesn't necessarily need to be a chairman. They could make an appointment ahead of time with any of the attendings on the faculty. It doesn't necessarily need to be a chairman.
And finally, what can you tell me about those 40 years that you spent here at Case Western and interacting and teaching resident, junior faculty, colleagues, medical students? What you can say about that?
Well, here's what I can say. I think the thing that's always fascinated me about surgery is that you can never master it. That up until the day I retired, I was still learning. Mostly you learn from patients. You do learn from other physicians, and you learn from your experience. And it is important never to stop being a scientist. Every patient is their own experiment, and there's so much to be learned from every one of them. And this is a lifelong process, and it keeps you young, which is a terrific thing.
Yeah, that's great. So you can see, Paul Priebe, a surgeon, sincerely, this is what we think. Retirement, I think, is just an administrative event in your life, because you still are our mentor, our teacher here at Case Western, and we are proud of us, despite that you don't come every day to see us. But it's a pleasure, and we are very proud of him and his history. We thank you very much. I hope you enjoyed this interview, and you can get some reflections about how is your very best way of learning at your residency program, and how can you profit the opportunity of maturing and getting more knowledge from also your mentors. So I hope you enjoy the rest of the day, and thank you for watching.
Thank you.